It's so good to see a good crowd out there. We're really happy that you could come today. What I'm going to be talking about is opting out of Medicare. And the reasons for opting out of Medicare, most of you probably are well familiar with and could really take up another 2 or 3 hours to go through. But at the top of the list, surely is the fact that Medicare obstructs, impedes, and interferes with nearly every aspect of the practice of medicine today. How many of you sometimes feel like this with the giant Medicare octopus in your office with its tentacles all over everything, directing every single thing that you do in your office? Or maybe you feel more like this, the 2,000-pound gorilla who's looking over your shoulder, everything that you do with cost containment high on its agenda. Or maybe it's more like this, feeling frustrated and restricted about how you can practice medicine, being told by Medicare bureaucrats who are not physicians what you can and cannot do. And then, of course, there's the risk of prosecution, prison, and ruinous fines. There's approximately 132,000 pages of rules and regulations in Medicare, and believe me, if they want to, they can find something that each one of you still in the Medicare program has violated. We've come to the point that it's much like the former KGB slogan, which was, "Show me the man and I will show you his crime." And then of course, there's the war on doctors. April 9th of this year, CMS released individual physician Medicare payment data, and this, of course, made headlines in newspapers across the country. Here's the headline in my area, the Buffalo News: "Where the Medicare Millions Go." And of course, they released the top 10 or 15 physicians in the community and how much each one of those were earning. The New York Times, in fact, even had an interactive thing on their website where you could go and punch in a physician's name and state and find out for any physician in the country how much they were obtaining in payment from Medicare. And they also looked at Medicare payments by specialty. And so if you look at this, it says specialists receiving the most reimbursements. And if you look, the supposed top earners here are internal medicine physicians. So now we know where all the millions are obviously going, according to Medicare, is to internal medicine physicians. Curiously, only a week before this was released in our area, the same paper ran an article on doctor shortages in the western New York and upstate area of New York. And they go through this whole article, and it's the usual thing about if we can just make more residency positions for primary care physicians, they'll come, and we can increase the numbers. And finally, toward the end of the article, they get down to the fact that, well, maybe the reason that a lot of physicians are not choosing primary care is because the payment is so poor, and that payment, of course, is mainly set by CMS Medicare. Medicare payments, in turn, are often used as the base for private insurance patients as well. So why this escalation of the war on doctors at this time? Well, it's pretty clear. The timing's pretty clear. At a time when people are encountering the sticker shock of unaffordable Obamacare insurance, and as Medicare continues on the path to insolvency, and as midterm elections approach, Obama is desperately trying to deflect blame away from himself and the Democrats who voted for Obamacare. Meanwhile, there's no mention of how much price discrimination in Medicare is costing patients. If you look at a typical example, this is an office visit. Medicare pays the physician in an independent office $58, and the copay is $14.50. If the exact same service is provided in a hospital-owned outpatient clinic, Medicare pays that clinic $98.70, and the patient has to pay an increased amount of $24.68. So the total for the service provided in an independent physician office is $72.50, whereas the grand total provided if that same service is provided in a hospital outpatient clinic is $123.38. And of course, as many of you know, there's the ongoing scam that is being used by hospitals called observation status, whereby they can keep a patient on observation status and bill these inflated outpatient fees under Part B instead of being subjected to the restricted DRG fees under Part A. The Obama administration also delayed cuts to Medicare Advantage programs, which are the managed care programs, until after the 2014 midterm elections. And instead of cutting the Medicare Advantage reimbursements, Medicare Advantage plans will now receive a 0.4% increase in payments for 1 year. Remember, though, that there are still $716 billion in cuts in Medicare that are planned under Obamacare. Approximately $156 billion of that will come from the Medicare managed care cuts. So it's being delayed, and you'll see this is kind of a pattern where these bad things that are coming up in Obamacare, they're being delayed beyond the midterm elections so it doesn't upset people. And I guess it's done with the idea that people must be stupid and can't figure this sort of thing out. As far as an SGR update, as you're probably aware, Congress recently passed a bill to delay the 24% cut in physician Medicare fees for 1 year through March of 2015 at a cost of $16 billion. The bill also delayed implementation of ICD-10 coding until October 1st, 2015, and the cost to small practices to convert ICD-10 to that coding system is astronomical. It ranges between $56,639 to $226,000. You have to understand that a lot of the people in Congress that pass these sort of things have never run businesses themselves, and they somehow think that good intentions can pay the bills and these things will work perfectly well. So major disruptions to cash flow are anticipated as a result of this change over to ICD-10 coding. You also have to remember that part of the funding of Obamacare depends on physicians absorbing a fee cut in the 24% range at some point. And while many physicians have been fixated on repealing the flawed SGR payment system, few noticed that a law has already been passed which will cut physician fees gradually over a period of time by 24%. You might remember the super committee that was supposed to come up with the 1.5 trillion or so cuts, and who could, of course, not agree on any way to do that. And so as a result of that, we, and the Budget Control Act of 2011, Medicare physician sequestration cuts of 2% went into effect on April 1st of 2013 for a 10-year period. On December 26th of last year, the Budget Act of 2013 was signed into a law extending the sequestration cuts for an additional 2 years. So that's 2% per year times 22 years. Guess what that equals? That's a 24% cut. It's also a little bit more than that, because for the first 6 months of 2023, the sequestration cuts are increased to 2.9%. and then lowered to 1.1% during the last 6 months of 2023. So while everybody's been fixated in we've got to do something to keep fees from being cut 24% due to the SGR, it's already been accomplished. And of course, the main problem in repealing the SGR and getting rid of it is there's no money to pay for it. And as there is no money to pay for a repeal of SGR, Congress is seeking other ways to drastically cut physician Medicare fees and to drastically change both the payment model and the ethics of medicine in our country. One of the main goals is to eliminate fee-for-service medicine and transition to a bundled payment model with restrictive treatment protocols under accountable care organizations. The value versus volume rhetoric that is associated with the current debate about how to permanently fix SGR belies a monumental shift in medical ethics from doing what is in the best interest of the individual patient to doing what is most cost-effective for society. Physicians who remain in Medicare will increasingly be expected to act as agents of rationing in pursuit of value to society. The oath of Hippocrates will be made irrelevant, and patient trust in physicians will be destroyed. The solution, of course, is to kick the 2,000-pound gorilla out of your exam room and reaffirm your commitment to serving individual patients. And the number of physicians who have opted out of Medicare has tripled from 2009 to 2012, and in 2012, a total of 9,539 physicians opted out in that year. So it's becoming an increasingly popular solution that physicians are choosing. So what are some of the factors to consider in making your opt-out decision? Well, there's financial considerations, of course. You need to consider the total revenue equation. The total revenue equation is gross revenue minus expenses equals net revenue. And you will come to discover that once you get rid of the huge administrative costs of continually interacting with the Medicare bureaucracy and the appeals and the claim denials and the delays, that you can actually achieve a decent net revenue and in some cases even lower your prices to patients. You need to look at the type of services you provide, the patient population you serve, and make an assessment about the ability to collect directly from your patients. And if you elect to stay in Medicare, on the other hand, you need to consider the cost of you and your staff keeping up with ever-changing Medicare rules and regulations and the cost of filing and handling Medicare claims, the appeals, relative to the relatively small amount of revenue generated. If you decide to opt out, it may also be helpful to find niche services if possible, and you need to think about how to develop a marketing campaign to inform patients of the benefits of seeing an opted out physician. Two primary benefits which all physicians can offer once they've opted out is, number one, they can often provide care in a much more timely manner. Patients won't be waiting 4 to 6 weeks to get into your practice. And the other thing, shockingly, patients actually appreciate more face-to-face time with an actual physician. And that's something that all physicians can provide. You also need to consider the cost of noncompliance. If you're not compliant with ICD-10 by October 1st, 2015, you will be subject to a 100% cut in Medicare fees because they won't process your claims. There's also e-prescribing. If you're not compliant with e-prescribing, you'll be subject to a 2% cut in this year. Meaningful use. If you're not compliant with meaningful use, the Stage 2 deadline is October 14th, 2014. Fees will be cut by 1% in 2015, 2% in 2016, 3% in 2017, and 4% in 2018, and 5% in 2019 and beyond. So there's a lot of cuts coming. Physician quality reporting system, if you're not compliant with PQRS, again based on 2013 reporting activity, fees will be cut by 1.5% in 2015 and 2% in 2016. There are almost more ways not to be paid under Medicare than there are ways to get paid under Medicare. Also, starting in 2017, CMS will make cuts to so-called misvalued codes, which are mainly codes used by specialists to meet certain budget targets. So the misvalued codes in general, I believe, will be those codes that tend to be expensive. And CMS will consider those to be misvalued. Then there's maintenance of certification. In order to obtain a 0.5% incentive bonus, physicians must participate more frequently than is required in at least one of the 4 components of maintenance of certification, and in particular must participate more frequently in the practice assessment component of MOC. And again, there will be a penalty for not participating in MOC, so even for the grandfathered physicians who are not required to participate in MOC, if you're in the Medicare program, you will be subject to a penalty beginning in 2016. Then there are the non-financial considerations. The freedom and pleasure of practicing medicine again instead of practicing bureaucracy. A positive patient experience and protecting patient privacy. And of course, you will sleep better at night because there's no fear of ruinous fines or prison time for inadvertent coding errors or running afoul of some other obtuse Medicare law, rule, or regulation. And you will also not be hunted down by the RACs, which are the bounty hunters, the recovery audit contractors who get a certain percentage of whatever they find has been overpaid to you by Medicare. And you won't be hunted down by the ZPICs, the Zone Program Integrity Contractors, which are sort of the arm of the bounty hunters that look to hook you up with criminal prosecution. Then there's simplification. The opt-out physicians need not use any codes. No CPT codes, ICD-9 codes in serving Medicare patients. There's no claims to file, no more constant Medicare hassles, more time to spend actually treating patients, and more time to spend with your family. So basically, it's the ability to experience the joy of practicing medicine again. In making your decision about opting out of Medicare, you should check all of your contracts and hospital bylaws to ensure that there are no conflicts. And if you're unsure about this, ask an attorney to review your contracts and any other legal documents that may be pertinent. So the procedure of opting out of Medicare is actually pretty simple. It differs a little bit between participating and non-participating physicians. All of the step-by-step instructions are present on the AAPS website. For non-participating physicians, you can opt out anytime during the year. You have to have a copy of the opt-out affidavit to the Medicare carrier no less than 10 days after the first contract to which the affidavit applies. I would recommend that you not wait until the 10-day period after you've used your first private contract, mainly because of the Medicare bungling factor. They tend to lose things or put them under a pile somewhere and not process them in a timely manner. There's also a 90-day grace period after filing the first affidavit, during which the physician may withdraw the opt-out affidavit. For participating physicians, those that have signed the Medicare agreement to accept assignment on all patients, you can only opt out 4 times during the year. And the Medicare contractor must receive your opt-out affidavit 1 month before the beginning of each quarter. So that means that the deadlines for the carrier receiving opt-out affidavits is March 1st, June 1st, September 1st, and December 1st. If you deal with more than one Medicare contractor, you also have to provide Medicare opt-out affidavits to each Medicare contractor you deal with. The other thing you need to know about is once you're opted out, you're not completely opted out in all situations. So in the situation where you don't have an existing contract with a patient, you cannot make a new contract with a Medicare patient in an urgent or emergency situation. In that instance, you provide the service and can file a claim with Medicare, in which case you are treated like a non-participating physician and you're subject to the limiting charge law. So this is the only instance where the opt-out doesn't apply, emergency or urgent care situations. As far as that early termination, that 90-day grace period, again, that only applies to the first time you've opted out. And you have to notify carriers again within the 90 days of the effective date of the opt-out, and you must refund to each beneficiary with whom you privately contracted all amounts collected in excess of the Medicare limiting charge. You must also notify all beneficiaries with whom the physician has entered into private contracts of termination of opt-out, and the beneficiary's rights to have claims filed on their behalf for services provided during the opt-out period. So it can be somewhat of a hassle if you decide to terminate the Medicare opt-out within 90 days, but it is possible, and you may have to file Medicare claims for all of those patients that you made private contracts with, and you may have to refund money that's been accepted in excess of the limiting charge. Again, you can download step-by-step instructions for opting out of Medicare. You can download the actual opt-out affidavit. You can download private contracts for use with patients, sample letters informing patients of your decision to opt out, which you should do probably 6 or 7 months in advance. You should notify your patients that you will be opting out, why you're opting out, and what the new procedure will be in your office. You can also find a number of other things on the website, including the letters informing patients of your decision to opt out. And you'll also find a list of physicians by state who have opted out, videos of talks given by opt-out physicians about their experience and tips for success, and a list of physicians in various specialties who are willing to serve as mentors and answer specific questions regarding the opt-out experience in their particular specialty. AAPS, of course, also offers these Strive Not Just Survive seminars, of which this is now the 20th of those seminars, a couple of times per year, various regions throughout the country. Again, we've posted all the information on aapsonline.org. Just a few tips for opting out. It's wise to start at least 6 months in advance of beginning of the opt-out period. This provides you time to inform your patients of the changes and time for your staff to adjust. And it also allows for the Medicare bungling factor. Remember that Medicare is probably the most incompetent government bureaucracy that exists. The Government Accounting Office's own study found that 96% of the time, Medicare customer service representatives provide the wrong answer when physicians call merely asking how to bill Medicare properly. 96% of the time, they get it wrong. If they were a private business, they would be out of business with that kind of record. You need to send a cover letter with your opt-out affidavit, certified mail return receipt, requesting written acknowledgement that the opt-out has been properly accomplished. You don't want to find out a year and a half down the line that they never got your affidavit or they lost it or never processed it, and then they're going to make you go through this thing where you have to refund money to patients and file claims, and it will be devastating to your office. So deal with that up front. Request them to put it in writing that you've properly accomplished the opt-out. You also need to mark your calendar so that you will remember to renew your opt-out 6 months in advance of the end of the 2-year opt-out period. When you divorce yourself from Medicare, it's not a divorce for life. It's only a divorce for 2 years. You have to re-divorce them every 2 years. You also have to update your patient private contracts every 2 years. Also, office procedures do need to be in place so that no Medicare claims are filed, again, except for those urgent or emergency situations. And again, if you have specific questions about opting out of Medicare or transitioning to a third-party free practice, feel free to call AAPS. We're here to help you in any way we can. And with that, I thank you for your kind attention.